Hi, this is Matt Kuntz. I'm the executive director of NAMI Montana, and we did one of these advocacy presentations a few weeks ago. It worked out really well, so I thought I'd try it again with another big advocacy effort that we have. And this is for veterans advocacy, and it's a project that we've been working on for years, and we're really hoping to get a vote sometime around Memorial Day. So I thought we'd update people and give them a chance to contact Congress to let them know that they need to support it. So this is the value-based care for veterans in the Veterans Health Act. And as always, when we talk about NAMI Montana's advocacy for veterans, I got to thank the Trans Montana Charity Ride, everything that they do for NAMI Montana and for our work on veterans just makes it possible. So thanks to them for all their years of support. So this is an effort to transition the Veterans Healthcare Administration away from fee-for-service reimbursement and towards value-based care. This is looking at a program called VERA, set up in the late 90s, which required VA healthcare organizations from around the country to receive their reimbursements in a fee-for-service style. And it's really not working. It's been over 20 years. It's time for an update. And part of the problem that's breaking down is fee for service has an overwhelming burden on licensed clinicians because they're the only care members whose tasks really qualify for reimbursement. So they end up doing way more than they should. So you might have a counselor doing tasks that really should be done by a case manager. And we did work on this with Senator Jerry Moran in the GAPS Act, where we got peer support reimbursed for VERA, but the fix really needs to be more systematic. So we're not playing whack-a-mole with every different kind of care provider or healthcare administrator. And it also really doesn't work for veterans receiving care that have treatment resistant conditions. So if you're going to need more than just standard hour based care from licensed clinicians, you need a system that really reflects that. It might be the veteran needs to receive care like transcranial magnetic stimulation, and those technicians that work on that need to be cared for, or to open up the door for things like legal psychedelic assisted therapy. This is going to be important. We have to have a care model that works for it. This effort has had major support from the American Legion, VFW, and the Wounded Warrior Program. We have special thanks to Emily Blair Rubright, Senator Jerry Moran, Senior Health Policy Advisor on the Veterans Health Affairs Committee, for her amazing work on this effort and this bill. This would not be happening without Emily Blair Rubright and Senator Moran. So we're incredibly grateful, as always, for our long-term partnership with them, and we look forward to continuing to work with them in the years to come. So this is the specific bill. It's Senate Bill 1315, Veterans Health Empowerment, Access, Leadership, and Transparency for Our Heroes. So the Veterans Health Act of 2023. And it is sponsored by Senators Jerry Moran, Republican from Kansas, and Senator Kristen Sinema, independent from Arizona. And it's a great bill. We're so excited to see this move forward. There's a lot of different things going on here. I won't go into all of them. You can see Title I has a lot of different work on the Veterans Community Care Program. This is a big program that's been going for years, and they're just continuing to work to make it better. And you can see in this, the rest of the sections in that community care program, they do have something that does have a report for value-based care models for community care. So they are looking to apply the same standard for both, but that is not, it's not the big value-based care push that we're going to be focused on today. That is going to be section 201, which is the strategic plan on transition of Veterans Health Administration to value-based care model. So you'll see that right at the top, underlined. And there are a lot of other different healthcare things that are tackled in the Veterans Health Act. But again, we're just going to have a laser focus on section 201. So at the beginning of this section, Congress starts out, and I'm not going to go word for word. I cut and diced it so we can move a little bit faster. But Congress has started out with some of their findings, such as the Creating Options for Veterans Expedited Recovery Commission report. It's a cover report. I was a member of that commission, and interestingly enough, I wasn't that focused on the value-based care piece at the time. I had veteran suicide prevention, peer support, and some other tasks. So I really want to thank Jake Leinekugel and some of the other folks that really dug in on this, that really focused on this part, because I didn't get it at the time, how important this was for our long-term transition. But you'll see it's not just that report. There was also a consensus study report from a few different other major organizations, and then looking at the National Academy of Medicine and the Institute for Healthcare Improvement, really aligned with a lot of things those organizations have said. And Congress highlights that at the beginning of this bill. So big question is who's going to be members of this commission, and this is where I think you can see that the bill really starts to shine. It has a really in-depth membership, up to 18 people from both governmental and private positions. So it isn't stacked in any one way to alter or mess up or do anything to the VA. Like, the VA is fully represented on this membership, and I think they're going to be essential to understand how. But they also have things like private insurers that have done this before, healthcare organizations. There's CMS. A lot of different agencies have done this. This is not new, and I think this bill does a good job at digging in and helping make sure that a lot of those different players are on the commission. Next up is they are going to be exempt from federal advisory committee rules. Having been on those federal advisory committees, I can see why they would be exempt. There's a lot of bureaucrats that go with that, and this is just a report. It's not forcing anybody to do anything. It's a report to Congress, and then a few pilot programs. So there's plenty of room to fix any challenges that may come along. And there are so many clear guidance on who's going to be on the commission that I do think it makes sense to trim some of the bureaucracy on the other side of it. Next up, this is where the meat of it is: developing the strategic plan. So in general, not later than 1 year after establishing the work group shall develop a strategic plan. And then it goes into what the elements of that strategic plan are going to be. This is really in depth, to say what it could take to transition the VA from fee-for-service to value-based care model. And that includes analyzing the leadership of the VA to see if they have the ability to do that, or if they need some help, if they need different positions to help them in that transition, which is a part of any change management project. Identifying the future goals for the VHA. We have changing demographics in our veterans, changing geographic locations. Really important to separate that out at the beginning. And then finding out current capabilities and gaps in the system, analyzing the different types of the care models, and then figuring out which model would best fit the Veterans Health Administration and justify what that means, including what does quality mean? What does it really mean? And probably this will go back to some of the federal care definitions of quality that bounce around through the healthcare administrative circles. Next up, an assessment of the workforce challenges and needs of the Veterans Health Administration. And again, I think that is where this could really shine, is right now we have such a heavy reliance on certain folks, and we're going to have to be able to make sure that they're supported and functioning at the right level of their licensure. And they're going to look at the value-based care framework in a lot of different ways. And again, the definition of value, assessment of the IT to make sure that this supports that. And then focused on value-based care for primary care, inpatient and outpatient mental health care, and inpatient and outpatient substance abuse. These are areas that are key clinical priorities for the VA. And this is part of what Congress is shooting for with value-based care, is to get better in those areas and those metrics. And then a description of the timeline, costs, legislative or administrative action necessary to make this happen. And then the committee is going to submit this to Congress, or the working group will submit it to Congress. Describes how that's going to happen, and then moving into pilot programs, which start no later than 180 days after that submission. Is going to be a 5-year pilot program. So again, really in-depth analysis, 5 years of pilots to make sure that it works right. And with this focuses talked above, and then also focuses on the different kinds of location to make sure that they're looking at high rural areas, urban areas, places with high rates of suicide, places with high rates of substance disorder, and places that have documented issues of workforce retention and recruitment challenges. So critical to make sure that this is pilot in the areas that we know struggle and that we know are going to be hardest to make this transition, but also where we could get the biggest benefits. And then requires an annual report to Congress for each of the pilot program years, and then a final report to Congress after the pilot programs are concluded, which we hope will then stir further congressional action. So you can read the full bill at this link, and please consider contacting your congressional representatives, senators, to ask them to support the Veterans Health Act. This is a key bill. It's something that we've been working on for years. We're incredibly grateful to Senator Moran and Senator Sinema for bringing this, and for Emily Blair Rubright for carrying it through Congress as a staff member. Thanks to everybody for your support, and let's go get this win. Thank you.